Hello, my name is Nikki Caraveo, and this is my final presentation for the practicum course, Leadership in Healthcare Systems with Dr. Janice Hill. The focus of this presentation is increased specialty certification in registered nurses for magnet status qualification at Citizens Memorial Hospital. The objectives met for this project are practicum organization and site, identifying the problem, project implementation, outcomes and sustainability, stakeholder integration and acknowledgement, acquired practicum knowledge and personal professional goals and AONL competencies. Citizens Memorial Hospital is in Bolivar, Missouri, and is a rural healthcare system comprised of the Public Hospital District and the CMH Care Foundation, which is a 501c3 designation. This facility serves 8 counties in southwest Missouri and is approximately 40 minutes from Springfield, Missouri. It maintains an ICU, PCU, telemetry, medical, surgical, long-term care, skilled nursing facilities, and outpatient clinics. They have emergency service, ambulatory care, and acute care designations with 86 beds. Their designations are important to note as they hold a Level 2 STEMI Center, Level 3 Stroke Center, and Level 3 Trauma Services for 4 counties, Cedar, Polk, Hickory, and St. Clair. They also have 34 physician offices and specialty clinics, with 14 of those certified as rural health clinics. Their long-term care facilities number in 6 as skilled nursing care with a total of 705 beds, 1 residential care center, and 5 independent living communities for seniors. CMH has home care services, including palliative care, home medical equipment, service and facility, and a health transit system to assist seniors and disabled individuals to make their appointments within their system. CMH is nationally certified from Detnorsky Veritas as an acute stroke ready center. They are also certified by the American Association of Cardiovascular and Pulmonary Rehabilitation for their cardiac and pulmonary rehabilitation program. The result of the needs assessment was found to be to increase specialty certification of registered nurses, as it became evident that the goal of CMH was to obtain magnet recognition. This is a system-wide goal of CMH in congruence with an overall project to provide professional development, recruitment of nurses with a higher standard of practice, and retention efforts to increase their employees' knowledge and validity in their practice areas. The assessment provided concerns within the organization, identifying gaps in nurse recruitment and retention, perceived lack of support from nursing leadership, perceived locality income variances that were lower than other areas, low nurse job satisfaction, and low patient satisfaction scores. These were directly related to knowledge deficits in the registered nurse population. It was also found that the need for specialized knowledge increased positive patient outcomes, patient satisfaction scores, nurse job satisfaction, nurse retention, and recruitment efforts would be increased through specialized certification efforts and would also meet the qualifications for magnet recognition. Magnet recognition is the gold standard of indications that the best practices by leadership, physicians, and nursing are being adhered to and aligns with the overarching goal of succession planning at Citizens Memorial Hospital. CMH recognizes the need for leadership development, which is a brand new initiative to identify, plan, and implement changes for nurse recruitment and retention. The tools utilized for determination of certification being part of that initiative was identified through meetings, a nurse survey, review of policies in place, knowledge of the attempt to reduce agency utilization, and to increase nurse recruitment and retention. Also, the goal for magnet recognition status has been placed into the strategic plan for the next year, with the possibility of extension for other succession plan goals. Currently, 22 nurses hold certifications in their specialty area that are on the accepted list of certifications at CMH. To obtain magnet recognition, it is necessary to achieve a 50.8% certification rate amongst the staff nurse population, which meant an increase of certification by 33% of the staff nurses. The process of developing my PICO question was to put the needs assessment into context by identification of the behaviors to change, the persons of the organizational units that need to change, and the ways to make those changes occur. The development of the PICO question for the defined organizational goal from the needs assessment determined the progress of the tasks to be completed in this project. The population is the registered nurses in the emergency department, medical surgical unit, intensive care unit, progressive care unit, and long-term care facilities that number 150 nurses total. The intervention is to increase certified registered nurses by 33% to fulfill the magnet designation requirements of 50.8% of nurses to be certified. The control will be the number of nurses needed to certify in their specialty area compared to the number of nurses who will complete certification in their specialty area. The outcome is the objective to reach 41 nurses to achieve and apply certification in their specialty areas within the facilities. And the time factor will be by the end of fiscal year and to be extended if necessary. A list of nursing certifications has been developed for the specialty areas and distributed to the nurse managers and nurse supervisors for nurses to apply. My presentation of certification for specialty areas in nursing was approved by nursing leadership, human resources, the nurse educator, a foundation representative, the specialty area nurse managers, and staff registered nurses. We titled the campaign as Grow With Us and address the barriers of time, cost, fear of failure, and disinterest, the lack of belief that it adds value or validity to practice. Through consistent nursing leadership, support was provided. We were able to convey sustainability of this project to the nursing staff. There have been 2 presentations of the material to date, and the result has been promising, with 28 nurses making application to certify in their specialty areas. There have been emails disseminated to staff with the Grow With Us campaign title and pictures from my presentation that have produced additional inquiries about the certification process within the organization by nursing staff members. Time is allotted for applicants in the education department for use of the computer lab for study purposes. The cost of the certification and application and resources is supplied. Providing the nurses with a clear education curriculum, resources, applications, payment of certification costs and resources, monetary awards, and encouragement that passing was possible helped alleviate these barriers. Of specific success, a slide was created more to the visual fit for the presentation, but with the same content attributed to the AACN that refuted the fear of failure by illustrating that having confidence in passing an examination is to provide better care to our patients at bedside, and all nurses can achieve certification in their specialty area. A CMH Foundation representative, Human Resources, Quality, Nursing Leadership, the Chief Financial Officer, Nursing Education, Human Resources, and registered nurses all held a stake in the change proposal of increasing nursing certification in specialty areas, which falls in the domains of transformational leadership, structural empowerment, exemplary professional practice, innovation, and new knowledge. The outcomes of the project will fall in the empiric outcome domain, which is the number of nurses who will complete certification. The receipt of the presentation was greatly appreciated, and new findings were discussed about the magnet recognition requirements for 50.8%, as the number was previously unknown prior to my presentation of the data. The change process was also well received by nursing leadership and staff. After the presentations, there are 32 nurses so far to sign up for specialty certification. This is a large number of nurses to volunteer, but the fund distribution being available, setting time for them to be able to utilize their education department computers made available to them, with paying them to come in for studying and providing them with the online materials to study and become successful in passing their examinations is an excellent motivator for them. The development of this program within the professional development projects that are in motion with CMH at this time will only add to the professionalism of their staff. They will be able to recruit nurses that are already certified as an adjunct to their hiring processes as well. The leadership support is present in this project, and the sustainability of this section in the professional development program will be there for a long time. The goal is to acquire magnet recognition, and this will assist CMH in that piece of the recognition requirements. It will also give CMH the capability to earn magnet recognition, but in addition to that, it will also provide a professional knowledge foundation amongst their nursing staff to improve their practice and patient care. Recruitment will be focused more on those registered nurses that have certification in place in their specialty areas, which will bolster the quality of patient outcomes and patient satisfaction scores. Through the various implementation theories, models, and frameworks that were reviewed during the practicum experience, I was able to understand the necessary elements that enables implementation of project management. It gave me perspective and understanding of the different types of resources that will be available to me in my knowledge base to perform future project implementations with successful outcomes. The AONL competencies that were fulfilled during this project were leadership domain of reflective practice, foundational thinking, career development, personal and professional accountability throughout my path to a leadership role within my practicum site. These qualities included committing to lifelong learning, reflective of the principles that we have learned about leadership throughout this educational process. Business skills and principles have been a part of this project implementation process to understand how finance affects the project feasibility, but on a long-term basis, how institutions can utilize our newly learned skills in areas of financial management, strategic management, and human resource management to further the vision and mission of any institution we are working within. Communication and relationship building skills were utilized throughout this process to further the goal and outcome of the project implementation and learning those essential skills to sustain effective communication, influencing behaviors, and relationship management that will enable future goals to be achieved in leadership roles. By following the healthcare delivery models that are dictated by regulations, nursing practice guidelines, and application models, economics and policy, substantiated evidence-based practice, and patient safety and quality measures, it will ensure increased positive patient outcomes. And lastly, maintaining accountability to the profession of nursing as an advocate with health equity and social determinants and governance skills in place to affect the healthcare delivery inside the institutions we will work will give lasting and solid contributions to the improvement of healthcare systems. These skills acquired throughout this project and the educational process will give me the necessary leadership skills to become a positive, successful servant leader in any leadership role I choose to put forth the effort and blessings that are bestowed upon me through God in my future career path. Thank you. Thank you for watching this presentation, and may you have a blessed day. Please feel free to ask any questions at this time.